Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your college of entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is infection control. So, particularly for those of you working in the UK, infection control does form quite a large part of many an induction day that we have when we start new rotations, for example. And so you'll probably be familiar with a lot of what we're about to talk about, but it is an important set of concepts that you can be quizzed about during your MRCP examinations. So we've tried to summarise the key points for you in this video. 10% of hospital admissions in the UK are due to infections, and 10% of inpatients acquire infections in hospital. Infection control principles are divided into universal precautions and specific advice. As you will be aware, hand washing is extremely important between all contact with patients, and protective clothing should be used when implicated. Gloves are recommended if there is a possibility of contamination with bodily fluids. More specific precautions include isolating patients with certain infections who pose a particular risk, and dissemination routes of the infections which are contracted within a hospital mainly include contact, droplets, airborne, or blood. Protective isolation is routinely done in special cases, such as for immunocompromised patients, for example, those undergoing chemotherapy, for example, or in those for whom contracting hospital-acquired infections would be particularly dangerous. So this would include people with cystic fibrosis. Nursing neutropenic patients in a filtered, positive pressure room reduces the risk of aspergillosis in particular. So here we have quite a busy screen, but it just summarises all of the different types of possible infections that may be contracted and the route of transmission. Not all of these, of course, would be common within a hospital setting, depending on where you're working, but it's just useful to have them conceptualised so that if you are asked about them, you can immediately recall the information. So let's now try a question. A 55-year-old woman is admitted to hospital with fever and profuse watery diarrhea after recently being treated with antibiotics for a urinary tract infection. C. difficile infection is confirmed. What is the most appropriate infection control measure to prevent the spread of this infection? So our options are standard precautions with alcohol-based hand gel, contact precautions and thorough hand washing with soap and water, airborne precautions and use of N95 respirators, droplet precautions and surgical mask, or administer prophylactic antibiotics to all healthcare workers. So you will be aware, probably from your own clinical practice, that the correct answer here is B, contact precautions and thorough hand washing with soap and water. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.